This is Carolyn Jarvis. She's a social worker at VGH, and she's going to talk to us about donor outreach. Thanks, Carolyn.
Hi everyone, I'm Carolyn. I'm one of the transplant social workers at Vancouver General Hospital. I work primarily in the living donor program, so I'm assessing donors pre-transplant and working with their recipients once they have a surgery date and then after their surgery and through recovery. And so today, what I'm wanting to do is talk a little bit about the psychosocial implications of donor outreach, to look at some of the barriers recipients can encounter when they start thinking about pursuing living donation, and how we as their healthcare team can help address those barriers, to look at ways to initiate donor outreach conversations with recipients in our work, and also look at just some of the practical ways recipients can be facilitating their outreach, so looking at some of the tools that they can use. By way of starting, I just want to do a exercise that I hope you'll participate with me in. So I just want you to start by relaxing and get comfortable in your chair. And I want you to think about somebody, I want you to take off your healthcare hat and think about these questions from a personal perspective. Answer them for yourself personally. And I want you to think of someone that you're close with in your life. Someone that's important to you, someone you care about. It can be a family member or a friend. So just think of someone who fits that for you and picture their face and think about why you value them and what kind of relationship you have with them, what they bring to you in your life. And then I want you to picture yourself approaching them because you're in need of a kidney transplant and you're wondering if there'll be a living donor option for you. And pay attention to some of the feelings that come up for you. How do you feel about that? The thought of approaching them for a kidney donation. And what do you think about that? Is it an option for you? Is it something you're comfortable? And take note of your thoughts around it, your concerns, if any. So probably for all of us, there would have been a range of responses. Some of us would have been completely comfortable with that idea, and some of us would have had discomfort around that thought, and then sort of the spectrum, there would have been a lot of responses from in between those two ends. Some of the discomfort that our recipients experience, which you may have also experienced, is based more on emotionally driven reasons. So I love that person and I could never ask that of that person. Or it could be more based on practical reasons, such as geographically they're so far away it just would be logistically too hard to do. Or that person's the main breadwinner of the family, so I could never approach them for those reasons. I think what's important for us to remember as we start to work with recipients around donor outreach is that for us, it's part of our work with them to help them receive the best treatment option for them, and it's part of their medical treatment plan. But for them, it's highly personal, so it really involves their hearts and their relationships, and it's emotionally driven for them. So we just want to be really sensitive to that when we're talking with them about stepping out and looking for a living donor option. Recipients, everybody obviously is very individual. There are some recipients that are comfortable with the idea of donor outreach right from the start, and they're able to start taking steps. Many recipients do encounter barriers that make it difficult. So some of the ones that we often hear recipients discuss is just feeling very uneasy about the magnitude of that kind of request. It makes them uncomfortable. They don't have a comfort level in that. They don't feel that they have enough information themselves about donation, so they're concerned about potential donors, and that lack of information makes them hesitant to start. They feel concerned or fearful for the donor's health after donation, and they don't have information about the long-term impact it potentially could have on the donor's quality of life and health. They feel concerned about their relationship with that donor, and they don't want it to be negatively impacted or changed. They're just not sure even how to go about bringing up the subject or broaching the subject. And then from the practical perspective, they're concerned about impacting the donor's responsibilities in terms of their work, child care, all the responsibilities that the donor has. And then sometimes ethnic and cultural beliefs can be a barrier for some people to feel comfortable to move forward with donor outreach. So as we've talked about, it can be emotional or practical, and sometimes what we need to do is just help the recipients address some of these. So by talking to them about these feelings, sometimes engaging your renal social worker to help them work through it, that can be what's needed for them to then feel more comfortable and equipped to move forward. And to provide them information on education can often be enough to address some of the practical barriers. And then again, we want to be providing them the information and tools so that they do feel that they have the skills to go about reaching out and pursuing living donation. As we talked about, it's an emotional process as well, so they need to have support, and they can get that support through their family and friends, but we as their healthcare team want to be involved in that as well. They look to us for support around their medical treatment plan and around outreach. And we want to make sure that they have accurate medical information. Sometimes recipients are reluctant to reach out, and they're basing it on a misinformation, or they're making wrong assumptions. So we want to make sure that they are making an informed choice. There are some recipients that are not comfortable with donor outreach and will choose to go on the donor wait list. We want to make sure that we keep them on our radar, because what they're experiencing now in a year or two from now may be different, and they may be open to look at donor outreach at that point. But as I mentioned, we want to make sure that they're making an informed choice, and we can start by giving them information and education, and that's how we can start the conversation up with them. It's been mentioned today that donor outreach and pursuing living donation, it's not a one-time conversation. It certainly is a process. It's part of the relationship we have with our patients, and it's an ongoing conversation. So often by giving them this education and information, that's enough for them to alleviate some of their concerns, and then they're ready to move forward. We certainly don't all need to be medical experts in transplant, but we do want to have basic information that we can be providing them and encouraging them to, explore living donation, to talk to us at the transplant centers, or to talk with you about any concerns that they have. So for us as their healthcare team, we want to be familiar with just some of the key medical information that can be useful for recipients and helpful for them when they start thinking about living donor outreach. So some of this has been touched on today. I'll just go through it quickly. Donors are thoroughly screened, so that can be very reassuring for recipients to know that we are also as focused on the donor and their health, and that we're cautious. We're cautious with our donors. It's important for recipients to also know that donors are able to explore living donation without any obligation or commitment. So they're able to back away at any point if they receive information that for them makes this not viable or comfortable. As it's been talked about, we don't want donors feeling pressured in any way. Donors are able to live healthy lives with one kidney. And as well, the recipients are thoroughly screened. So in this program, our goal is two-pronged. We want to protect donor health and improve recipient health. And then the other options through the KPD and ABO incompatible programs have been discussed. So it provides greater options if they don't have a direct match. Sometimes recipients are confused about who can actually be their donor, and that holds them back from even stepping out. So I've had recipients say to me that because in their family there's illnesses, they just automatically assume that these people would not be eligible. So they were self-screening potential donors out. So we really want to encourage recipients, if people express an interest about possibly being their donor, that they follow up, get information, talk to the transplant centers, because sometimes what recipients are assuming could be a barrier are not. It's not. So donors can be family, friends, co-workers, anybody in a social circle, community group, anybody that they know. It's been already discussed that they can come from other parts of BC or other parts of Canada. Some of the out-of-country donors can be considered, and the kidney paired donor program really does provide even greater options. So we want recipients to be aware that their donor pools are greater than sometimes what they think. As we know, multiple donors can be screened, and they don't have to be a direct match. Some of the main emotions that can come up for recipients that sometimes are a barrier is fear. So some recipients talk about feeling fearful that once they make their need known, nobody will step up on their behalf. And they can equate nobody stepping forward as a reflection on their self-worth or their relationship. And if as we all know, sometimes when people have had chronic illness and are not feeling well and have been struggling with it for a while, they can be already feeling depressed or low mood or, helplessness. And so they don't have a lot of extra emotional reserves to begin with. So the idea of reaching out for a donor option, it's almost too taxing. So what we want to do is make sure that the recipients understand that oftentimes donors don't step forward for reasons that are completely unrelated to the recipient and their relationship with the recipient. Donation is not the right psychological or emotional fit for everyone. It is the right fit for many people, but there are people that it just is not a comfortable fit. We're all wired differently, and that has nothing to do with the recipient. So we really want the recipient to be able to separate out donor outreach and the process of donor outreach as a separate entity and not use it as a reflection on them as a person, their value, or a measure of their relationships. And by doing that and helping them with that, it can free them then to not feel so pressured and feel like it's so weighted in some senses. The other thing is that everybody has their private life, and there's lots of things we don't know about people. And so it could just be that some of their donors have personal issues happening. So perhaps there's a bankruptcy or a job loss, or they're facing their own health crisis, or have a sick child or ailing parent. There's lots of things that can be going on that people aren't aware of. And it's another reason we want to be encouraging recipients to continue the conversation and keep getting their need out there, because what may make it not right timing for a donor now to step forward may be resolved in a year or two. So their situation may be different, and it may be the right time for a donor to step forward down the road. As we mentioned, they feel concerned about the relationship. Recipients worry that by accepting a donation, it could impact, change, or strain a relationship. They worry about feeling indebted. In every relationship, there's, generally speaking, balance and power, and sometimes recipients feel that that may get shifted so that it's unbalanced. And in terms of relationships, if there's patterns that already exist, I'm thinking of a brother and a sister that I worked with, and the sister always sort of played more of the mother role and was quite doting, and the brother really wanted to accept a kidney donation from the sister, but was worried that that pattern would get shifted even more so. And for him, that was uncomfortable. So it's really important for recipients to know that donors are equally concerned for the relationship, and when I work with donors and am assessing them, I hear continually that they don't want the relationship to change. They don't want this to be impacted. Many donors talk about feeling uncomfortable with the tension and feeling like that they sort of don't understand what the fuss is about. Of course they would do this. So, and they don't, it's because they do care and do care about the relationship that they're stepping forward. So they see their donation as a gift. So communication can be a real key in these kinds of situations, and we as a healthcare team can be helping donors and recipients have conversation, because usually they're on the same page in terms of what they're concerned about and in terms of what they want post-transplant. But sometimes, because it is such an emotionally charged subject and difficult for a lot of people to talk about. They haven't had that communication. So again, if you can involve your renal social worker as one option or help facilitate those conversations yourself, it can alleviate concerns about the relationship. And the other piece is that donors are really well screened for motivation to make sure that it's right for them, and it's going to be, we're really focused also on preserving relationship. That's important. And then, of course, uncomfortable to ask. So the magnitude of the request being so great, and they're not really sure how to make the request. And for some recipients, they talk about asking makes them feel even a little more dependent, and they may already feel dependent on the medical system. Now they're depending on someone else for help. I think that it's really important for recipients to know that donors often offer to donate. The question never needs to be asked. So as soon as they know there's a need, they often step forward to be screened. So I think one of the key things for us as a healthcare team is to really help recipients not see a donor outreach as asking a question, but rather shift the focus more to communicating their medical need, communicating their medical situation, getting that out there. And oftentimes the question is never needed to be asked. And that can really sort of take some of the pressure off what the recipient is doing, what the pressure in donor outreach. Also, if we can kind of help recipients to feel that by doing donor outreach, this is one thing that they can be proactive in terms of their medical plan and treatment option and working with the medical teams. It's something that they can have some control in, and it can be empowering if we help them to see it that way. And then they often just don't know how to start or where to begin, and we'll look at some of the tools in a little bit, but there's certainly tools available to assist them communicate their need, which is important. So by addressing these barriers, and whatever the barrier is that the recipient brings up, it certainly decreases the pressure on the recipient, so that it allows them to communicate their need more from a place of strength and comfort, not feeling like their self-worth, their self-value is being measured. By giving them proper education and information, they can communicate their need in a way that is comfortable for them and kind of addresses any of their concerns. And so when they're able to communicate in a more relaxed way, then donors are much more able to receive the information and hear the need without feeling the pressure or anxiety coming from the recipient. So it actually will increase the effectiveness of their outreach. So some of the keys for recipients is for them to understand and to accept that donation isn't the right fit for everyone. There are people that I've had donors come through my office that they want to be able to do it, but it just doesn't sit right with them and they struggle with it. But a lot of people, donation is right, and those are the donor pool people. We don't want donors to feel pressured or obligated. We want them to be able to explore the process and get information. And donors usually, as they go through the process, feel more and more confident it is the right decision for them, or if they learn something that kind of changes their mind, it gives them the opportunity to resolve that and settle it for themselves. So we really don't want donors pressured. And that recipients understand that finding a donor is a process and it's an ongoing conversation. There was a recent example of recipient and donor where this recipient has been looking for a donor option for a while and communicating her need. And she went into the store and was talking to her friend who worked there. And she was telling her friend that, she was getting the word out, but there still wasn't any donor options coming forward for her, but she was, still working at it. And they had a conversation and she left the store. And that friend told her coworker, really hope that lady gets a transplant. She's been working at it for a long time. She's got a child. And that coworker said, I'll do it. So you never know how it can happen. I mean, that doesn't happen every day, but it's possible, right? So we want to encourage our recipients with those kinds of stories because they do happen. And it's because she was still talking and keeping the conversation going. So for us as a healthcare team, what are some of the barriers for us in terms of helping recipients with donor outreach? So someone earlier was mentioning how, particularly in kidney care clinics, the workload demands, time constraints can pose a bit of a problem. Some of us are more comfortable with having an emotional conversation with recipients because it is an emotional subject than others. And some people sort of identify that they're just not as comfortable communicating about these kinds of things. So it is important to kind of evaluate what you do at work and how you might be able to incorporate starting some donor outreach conversations within the work that you're doing. And again, if you have some of that basic information that we've talked about, how you can start up some conversations with recipients about outreach. So the goal being to at least initiate the conversation, provide some basic information, and have suggestions on how recipients can further follow up. Do as much as is comfortable for you. And just like I said, have the basic information and education that you can be answering some of their initial questions or concerns. It can be as easy as just asking an open-ended question. Have you explored finding someone to donate to you? Have you looked for a living donor option or ever thought about finding a living donor? It's as easy as that as you go about doing your work. And, you know, if they're saying yes, then you can find out what happened, and no, you can find out what's holding them back. And if you identify, you know, a practical barrier or an emotional barrier, you're comfortable to do some of that support work with them, you can start with that. If it seems like it really is something the person's struggling with emotionally, then you can engage the renal social worker to start working with them around that as well. And certainly you can refer them to back to their medical team, back to their nephrologist to get medical information. So in your response, you can be letting them know that you're learning about living donation and outreach. There can be more options than they think, that you would encourage them to get information before they decide it's not right for them, so that that you would encourage them to explore it. And you can let them know there's help. There's help for them to find a donor and how to do outreach. And that, you know, it's important to make an educated choice and an informed choice. And there's probably more encouragement and more positive for them than they may think. So obviously ways to explore living donation for them is to speak to their nephrologist and ask the medical questions and begin the conversation that way. The renal social workers can provide support around the emotional barriers and some of the emotional concerns and relationship issues. We're certainly happy to partner with the kidney care clinics and healthcare teams to provide, you know, consultation and to liaise if you have questions about how else you can be supporting your patients or starting that kind of conversation. And then, of course, BC Transplant and BC Kidney Foundation have resources as well. So I just touched on that. We have information and resources. We can also speak directly to recipients and to donors, and we encourage donors to call and follow up, and again, to not have self-screening happening. So when we get to the place where the recipient is now feeling comfortable to actually start donor outreach, again, we want them to be focusing on communicating their medical situation and getting their message out, as opposed to feeling like they have to ask a question. So, you know, it's important for them to keep their family and friends informed on their medical situation and what's happening. Again, people are using technology and social media to do this. So whether it's email or Facebook or blogs, however they're putting updates out there, we're seeing more and more of that. Again, everybody is unique and individual, so it really is what that person is comfortable with. There was one gentleman who had a number of siblings, and they all lived fairly close geographically, and they were close relationship with each other, and he had a family meeting, and they all sat down together, and they were talking as a group, you know, and now that's a pretty high functioning family, but I guess that's what worked for them, so it's possible. So it's really about people looking at what is their comfort and how do their family and friends work. You can appoint someone to speak for you. So if a recipient isn't comfortable to put the word out for themselves, they can ask someone to do it on their behalf. I think what's really important about a spokesperson is that the spokesperson is also sensitive to the message and the needs of the donor. Sometimes spokespeople can take it on as if their goal is to get this person transplanted, which is their heart is in the right place, but they may go about it a bit aggressively. And I remember one situation where there was 2 donors for the same person who had a spokesperson, and they were kind of in my office like this, really more because they were kind of scared not to be there because of the spokesperson. So the spokesperson's lovely and doing what they think is right, but not maybe in the right way. Again, have people come to your medical appointments and your to meet with the healthcare team so that you can ask questions then, talk about your own medical situation, and get further information. So when you actually go about writing a blog or a letter, if that's the method that they choose, they want to just state their medical situation and that they've been advised that a living donor transplant is their best treatment option. And they may want to include things like what the kidney disease is like for them, how it's impacting their life, and if they know what their wait time is for a deceased donor transplant, to include that. The things that can be reassuring for donors initially is to know that obviously they can live a healthy life with 1 kidney. If the recipient can communicate they know donation isn't right for everybody and that's totally okay, then it frees up donors from feeling obligated in any way. And then have the contact information for the transplant centers for any donors who would like to gather more information and be in touch with us. It's really important to keep it factual and state the need. It's best if you can address your letter or email to a group. When you sort of go, "Dear Bob," it can put a lot of pressure on Bob. So when we sort of address it to "Dear Family and Friends," that allows people again to know that it's not all on their shoulders, so to speak. Someone mentioned earlier, it is good if you can start with your own social, your family, your friends, your own groups where there is connection, where there is relationship. Tends to be more investment when there's a relationship there. We are seeing more and more people stepping forward now anonymously or after hearing through so-and-so and so-and-so or seeing a Facebook post. So it's not like it doesn't happen, but definitely when you know the person and you're in touch with the person, that connection really does seem to help. And again, talked about reassuring the donors who can't step forward or it's just not right for them, because that preserves that relationship too. And often when donors know that they can come forward and you don't have to commit by getting information and being screened, that encourages them to move forward. So we have sample letters, and we're going to be talking about some of the tools in a little bit. There's pamphlets and guides, and you can look on the BC Transplant website as well as the BC Kidney Foundation website. That's a place where recipients can start looking for some of these tools and getting information, or again, contacting the transplant centers. And we want to make sure that we get this information to you as well so that you have it to help you in some of your conversations. So as mentioned, it's not a one-time thing, it's an ongoing process, and it's a bit of an emotional roller coaster because sometimes people have a number of donors that can come forward and they're not able to donate for whatever reason. So we want to be providing emotional support to the recipient. We want them to have perspective that it can take a little while. And we've touched upon some of the challenges the transplant center has in terms of confidentiality, and sometimes it may appear to a recipient that things have happened when they haven't, or vice versa. So we want to encourage our recipients to trust the process, that we do want to get them transplanted. It's our goal. And also to keep them focused on the positives of their efforts so that they stay engaged. And they can do this by doing regular updates for their family and friends. And again, by doing that, you keep the message out there so that it's the matter of the timing. It may be better timing when that next message comes out for a donor than previously. So those are our contact numbers. And I don't know if there's any questions for me. Hi, Mimi.
So, my question is oh, sorry. It's not even on. Okay. The donor tools, the donor outreach tools and so on, is that available? Because I know you're with the solid transplant side of things, but is it available at the pre-transplant side? Because I just want to share that 4 years ago, I was told by my nephrologist that my GFR was at 19. And I actually wasn't given any donor outreach tools or even, quite frankly, advised to speak maybe to the social worker there. And I did it on my own, you know, and so I'm just wondering if things might have changed since then.
I
if
think
it's
that they
available
are
now.
in the process of changing. We're definitely developing tools. There have been some that have been developed. I'm sorry that was your experience, and good for you to persist. But definitely there's a standardization of tools that are happening between St. Paul's and VGH, and we're also looking at rolling out education for people, healthcare teams in the province as well. So yes, I think, I'm not sure exactly what's available on the sites right now, but it's definitely, there are tools available we can send to people, and it's in process.
No, that's great. And I just want to say that I think that part when you were talking about for the person, for the recipient who's trying to reach out and, you know, how do you ask someone for a kidney? I think what you said was very appropriate because in my case, I never asked anyone for a kidney. I just told my story to my close friends first. And
Yes.
one of them stepped up and said, hey, I'm healthy. Let me test for you. So I think that's really important
Yes.
that they don't feel like they have to ask for it because it's very overwhelming,
Yes.
absolutely, at that
Yes.
point. So thank you for making that
Well,
point.
thank you. Hi, Dr. Johnston.
Thanks very much, Carolyn. That was really good. I wonder, could you talk a little bit about a different scenario whereby, say, a dad who is getting assessed for transplant and his children all want to come forward, and he's like, no, no, no way. And it's more like a cultural barrier, I guess emotional barrier as well. I always find that very difficult, even when you give them education as to the benefits, to break that down. And even though the daughter's sons are very, very eager to donate, but the parent will not accept.
I see, so the parent needs the kidney.
Yeah.
And so it can get very complex, and again, depending ethnic origins, families are viewed differently. The first thing I'm wondering about is how old are the kids? So let's assume that they're, you know, not 18, because then it's all about some of what you two have already discussed in terms of donor health long term. So if they were older kids in their 30s, I think that there's an opportunity then to talk to the dad about some of the things that we've covered, that, you know, they love their dad, that we are protective of donor health, and that we are cautious, and so that if they're approved, we feel that this would not impact their health long-term, whatever the health issue is happening. And that, you know, it's very hard to accept a gift from a child for some people, but to talk to them about the perspective of the donors in that situation. They love their dad, they want their dad around, and probably, I mean, not having spoken to these imaginary children, but probably they would say that I really want to do this. It's nothing, you know, of course I would do this. He would do anything for me. So sometimes it's just about communicating their perspective. Sometimes if you can facilitate, even if it's an open kind of conversation where he knows and they know and they're comfortable to speak together, you can facilitate that and discuss the concerns, and normally that kind of thing can be alleviated. That comes into the attitude, value kind of belief, and there would be some parents that would never get comfortable with that. So that, I guess, has to be respected as well. But I think sometimes when we can really help the recipient to see from the donor perspective and have an open conversation, some of those concerns can be alleviated. I don't know if anybody wants to add anything else.
No, I think that was a great answer, and that I try to reflect in the same way. First, focus on the safety, but then also try to help them see it from the perspective of their son, their daughter, and how they're perhaps depriving their child of an opportunity to help them, and the guilt that may even be associated with in families when they aren't allowed to donate, or they can't come forward, and then there's a bad outcome, and. We, and you have to be very culturally sensitive. I
Yes.
agree. And some cultures are that barrier is very, very strong.
Yes.
And again, you need to be very sensitive to that. But even with pretty strong barriers, with ongoing dialogue, I think having a dialogue with the family there or with other members there,
Yeah.
we've been able to we've been
Yes.
reasonably successful in breaking down some of those barriers. But that's a big challenge.
Yes. Oh, Peggy, or?
Sorry, Carolyn, I don't have a mic. I know you mentioned that there are some resources on the website. I know that transplant programs put together a couple of pamphlets, one on finding a donor and one on the living donor process, and those are available and translated on the BC Transplant website under Become a Living Donor.
Okay, just for the remote sites, Peggy from BC Transplant was just letting us know that some of the resources are on their website and some of them have been translated. But yeah, it's a good point that Mimi made, and we do want to make sure that these resources are accessible. So I don't know if that's a good lead in, if there was no other questions. One more.
I'm just curious, for our donors who are very engaged and want early information, perhaps the recipient has not been referred yet. I'm just wondering what the resource pool looks like on your side with respect to those potential phone calls when the pamphlet isn't enough information and they want to actually talk to somebody. What are your resources like to meet those calls?
So Ruth and Sharon might want to speak more to this, but we would invite them to call. Their donors are always welcome to call at any stage of the process and discuss any of their concerns or questions and start gathering information, so that in a way that I would imagine is encouraged, so that when the recipient is ready to be referred and worked up, we've already made some strides with potential donors. So they absolutely, would encourage donors to call and speak to the transplant coordinators.
And you have enough resources to meet those phone calls? I'm just
For the
concerned
most
about a delay in somebody getting back to those people when they call and potentially them losing interest.
Right. Do you want to speak to that, Ruth?
I think in most programs, we get back to them within a day or two. Yeah.
I mean, it's a good point, and I think, we're in a process now where we're all, this is with something we've been doing, but we're really working more together now in terms of donor outreach. So some of the education and the rollout that's going to be happening is going to help with this as well. So help people that are in the kidney care clinics and all around the region be able to have some of the conversation and initiate the conversation. But if it gets to the point where they're needing more information, then definitely we're happy to talk with them.
So, but we wouldn't be involved with the donors. We'd only be involved with the recipients.
Yeah,
so that's
no,
what I'm talking about, is just the
encourage
donors,
the donors to call us for sure.
Okay.
Yeah.
Mike. Oh, did it work?
Yeah.
Hi. I'm just wondering if you could, and maybe you might address this in your toolkit, but language barriers for folks that English isn't their first language.
In terms of
Just starting the conversation about potential donors and with the recipients. I think we've run into it a number of times at our clinic where we're not sure about the comprehension of what's being discussed.
and my first response would be to try to arrange interpretation, right?
Yeah.
Whether that can happen through the place that you're working or whether they are comfortable to bring somebody else, a family or friend who can assist in that conversation. Material is being printed in different languages as well. So I think that's the best way to go about the communication factor, because you're right, you want to make sure that we're understanding the question and giving them the information that they need.
Mm-hmm.
So like, are you thinking even when recipients or donors come over to be assessed at the like in their assessment
No,
appointments?
I think my question was more along the lines of if like, I guess with social workers involved, that provincial language services is a well-known resource
Yes.
for that sort of thing, and just if that was something that's included in toolkits or, you know, as part of the discussion when it happens.
I think that some of the tools are being translated into different languages. I don't know that, so you're suggesting that to put that contact information as a resource for people who may run into needing
I guess I'm asking
interpretation?
if it's already in there, just.
I don't know if it's already in there,
Okay,
but that's a good suggestion for us to be aware of moving forward.
okay.
Yeah. Okay.
Thank you, Carolyn. Does anybody need a seventh inning stretch just for 2 minutes just to stand up? Let's do a seventh inning stretch.